You're peeing more often. You're waking up at night. Your stream is weaker. And maybe you're wondering, is this just aging? Or is something wrong? Hi, I'm Dr. Max, urologist and men's health expert. Today, I'll show you how to protect your prostate, prevent common urological issues, and take control of your health, starting with what you do at home. Because self-care isn't just about bubble baths and yoga. For men, it's about daily choices that keep your plumbing, your hormones, and your energy working the way they should. I'm giving you the real playbook for prostate care, urological health, and self-care every man over 35 should know.v. Men's health doesn't start at the doctor's office. It starts at home. Here's what most guys don't know. By the time you feel a problem down there, your prostate, bladder, or hormones, it's usually been building up for years. Most guys ignore the early signs, wait too long to act, or think that real care means pills or surgery. The truth? Prevention, lifestyle, and smart habits can do more for your urology health than any medication if you know what to focus on. This video is packed with practical tools: how to eat for prostate health, what habits quietly destroy your urinary system, when to see a doctor, and when you can handle it yourself. Alright, before we talk solutions, let's get clear on what we're actually dealing with. The prostate. You've heard of it, maybe had it checked, but what is it really? It's a small gland about the size of a walnut that sits just below your bladder and wraps around the urethra, the tube you pee through. Its main job? It produces some of the fluid that makes up semen. That's it. But despite its size, it causes a lot of issues as we get older. There are 3 big ones I see all the time. First, BPH, or benign prostatic hyperplasia. That's just a fancy way of saying the prostate is getting bigger. It's not cancer, but it can seriously mess with your flow. You feel like you need to go all the time, the stream is weaker, and you're still not sure you emptied fully. Second, prostatitis. That's inflammation or infection in the prostate. It can come out of nowhere, sometimes with pain, sometimes just discomfort or pressure. And the tricky part? It can become chronic if not treated right. And finally, the one most men fear, prostate cancer. It's actually the most common cancer in men over 50. And the scary thing is, in the early stages, it often doesn't cause any symptoms at all. So here's the deal. These 3 conditions, BPH, prostatitis, and prostate cancer, can feel very similar in the beginning. Frequent urination, discomfort, slower stream. That's why you don't wait and guess. You check. You catch it early. So now that you know what the prostate does and what can go wrong, let's get into what actually keeps it healthy. And no, I'm not talking about magic pills or complicated routines. These are 5 simple, science-backed habits every man should build into his daily life. Number 1, hydration. Drink water. Sounds basic, right? But most guys are walking around dehydrated. Aim for about 2 to 2.5 liters a day, more if you're active. Water keeps your bladder flushed, reduces risk of infections, and supports kidney and prostate function. Just one tip, taper your fluids in the evening. You don't want your bladder waking you up all night. Number 2, diet. If your plate is full of red meat, fried food, and sugar, your prostate's not happy. What works better? A Mediterranean-style diet. That means more vegetables, leafy greens, fruits, healthy fats like olive oil, nuts, seeds, and fish. Tomatoes are great too. They're high in lycopene, which may help protect prostate cells. And don't forget fiber. It supports hormone balance and gut health, which are more connected than you think. Number 3, exercise. You don't have to become a triathlete. Just move your body daily. Aim for 30 minutes a day. Brisk walking, cycling, swimming, whatever gets your blood flowing. Why? Because it lowers inflammation, helps regulate hormones, and even reduces the risk of BPH. Bonus tip, train your pelvic floor. Kegels aren't just for women. A strong pelvic floor helps control urination and supports erectile function. Number 4, smart bathroom habits. Don't hold it in too long. Don't strain. Go when you feel the urge and give yourself time to fully empty your bladder. Sounds obvious, but this alone can reduce pressure on your prostate. And number 5, sleep and stress. If you're sleeping poorly or stressed 24/7, your hormones go out of whack, especially testosterone and cortisol. That affects everything from your bladder to your sex drive to your energy levels. So yeah, managing stress isn't just mental, it's urological. Bottom line, your prostate isn't fragile. It just needs maintenance. Like your car or your back. Take care of it, and it'll take care of you. Now, a lot of guys ask me, Doc, what about supplements? Are there natural things I can take to help my prostate? Short answer, yes, but with some caveats. Let's go through the ones that actually have some research behind them. First, saw palmetto. This is probably the most popular natural remedy for enlarged prostate. Some studies show it can help reduce urinary symptoms, like urgency or slow stream, especially in mild cases of BPH. It's not a miracle fix, but it's safe for most men and worth trying if your doctor agrees. Second, pumpkin seed oil. This one's been shown to support bladder function and reduce inflammation. It's rich in zinc and plant sterols, both of which are great for the prostate. Third, micronutrients. Zinc, selenium, and vitamin D all play a role in hormone regulation and immune health. If your diet is poor or you're deficient, a good multivitamin can help fill the gaps. Then there's lycopene, that's the antioxidant found in tomatoes. You don't need it in a pill, just eat cooked tomatoes, tomato paste, or even watermelon now and then. And finally, beta-sitosterol, pygeum, African plum extract, and stinging nettle. These plant-based compounds are often found in prostate formulas. Some show mild benefit in symptom relief, but again, don't expect instant results. And just a reminder, natural doesn't always mean safe. Always check with your doctor before starting anything new, especially if you're on medications. Alright, let's talk red flags. Because while most prostate issues build slowly, some signs mean it's time to stop guessing and get checked. Here's what you should never ignore. Blood in your urine or semen. Even just once. That's a big red flag and not something to wait on. Sudden changes in your flow or urgency. If you used to be fine and now it's a weak stream or you're rushing to the bathroom, that's a sign your prostate might be pressing on your urethra, or worse, that there's a blockage. Painful urination or ejaculation. Could be infection, could be inflammation, either way, it's not something to tough out. Erectile changes. Not just performance anxiety. I'm talking about consistent issues with firmness, duration, or no more morning erections. That could mean blood flow problems, hormonal issues, or prostate changes. I tell my patients this all the time. Your body whispers before it screams. If you listen to the whispers, you avoid the emergency. So now the big question, when should you actually go see a urologist? Let's make it simple. If you're over 50, you should get a prostate screening every year, even if you feel fine. That includes a PSA blood test. It checks for prostate-specific antigen levels, which can help detect cancer early. And yes, the digital rectal exam is part of it. It's quick, it's simple, and trust me, it's a lot less scary than what happens if you wait too long. Now, if you're high risk, that means you're African American, or you have a family history of prostate cancer, start screening at 45. Earlier if needed. These checkups don't just save lives, they give you peace of mind. I've had countless patients say, Doc, I wish I did this sooner. Don't wait for symptoms. Don't wait for pain. You're not just checking a box, you're taking ownership of your health. You don't have to wait for symptoms to take action. You can build a stronger, healthier future starting today. Take care of your prostate. Train your pelvic floor. Eat better. Move more. And talk to a doctor who actually listens, not just writes prescriptions. If this video helped clarify things for you, share it. Like it, subscribe. And if you've got questions, leave a comment. I read them and I'll answer what I can. You're not alone in this. Take control, stay strong, and I'll see you in the next video.